Hello, everybody. This is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator, and you're watching Aging Strong. Aging Strong is sponsored by the Quincy Health Department. And for all of you who have been watching all along, you know how I love to invite different guest speakers who can talk about topics that is important to older adults. And that necessarily doesn't have to be 65 and up. It could be 40 or 50 and up. And today's guest speaker will talk about a topic that pertains to a wide range of age groups. Her name is Ashley Mahan, and she's a physical therapist. Actually, she's a doctor of physical therapy, and she's going to talk about pelvic health and how important it is and why people should know about it. Ashley, welcome.
Thank you, Debbie. I appreciate you having me on.
I know you have a slide presentation, and
Yeah.
before you put that up, I just want to ask, what made you get into the field of physical therapy versus occupational therapy versus respiratory therapy? A lot of different therapies out there,
Yeah.
as you know.
No, definitely. That's a great question. It honestly happened a little bit by chance, honestly. When I was going through, high school and into college, so I actually got my bachelor's degree in exercise science. So I always knew I wanted to work on a personal level with people and be in the medical field. And I actually got an opportunity to actually shadow a PT that my mom was actually seeing for her own personal care. And my mom has dealt with some various health issues of her own. So just kind of seeing her journey through that. And that's actually how I really got exposure to PT. I know a lot of other PTs, sometimes their story is I had my own sports injury and I had to go through rehab myself, but I didn't really go through anything like that, honestly. So once I got the exposure to getting to visit that clinic, that's where I kind of realized the personal touch that I think PT has in terms of people's medical care. It's great because you get to spend so much one-on-one time with people. Even in my own personal practice, we spend 40 minutes one-on-one with people during their follow-ups, and it's a lot more time than usually people even get to spend with any of their doctors typically. So I do really love that you get to know your patients very well. You get to develop connections and, just help them along the way, hopefully meet their own personal goals.
Yeah, I got to tell you, physical therapists are game changers. Daughter of aging parents, I have certainly taken my parents, post knee surgery, post hip surgery,
Yeah,
all these, or even after a fall, right? So
totally.
it's so important to, ask your primary care doctor if you have fallen and if you feel like you have this inability to kind of balance yourself or coordinate, and you seem to be holding on to a lot of furnitures, don't be afraid to ask your primary care doctor for a physical therapy consult. But for those
Exactly.
surgery, if you've had surgeries for the knees and the hips, definitely that's part of the treatment plan. And I have to tell you, it's the therapists have been so amazing. It really does help the individual get back on track.
Totally. And it's kind of nice that you just have someone guiding you through the process because, yes, you can maybe get a list of exercises and be like, okay, you're just going to perform these 5 exercises. But then you get home and you wonder, okay, what the heck am I doing? How am I supposed to? Am I even doing this correctly? So I think it's really nice when you get that one-on-one time with someone to ask all those questions directly, ensure that you're doing the right things because I always joke with my patients, if you're going to spend the time and do something, you better make sure it's correct. Otherwise, it's just a waste of your time, right? And it really helps, I think, just to have that extra feedback and a little bit of that extra hand holding that I think we all need in certain things.
Exactly. I mean, it has to do with confidence building as well, right? So some
Totally.
people are just not sure. So that consistent motivation, accountability, the proper way of doing it,
Exactly.
so important. That's where physical therapy comes in. So I know, so we've been talking about the typical type of physical therapy, right?
Yes.
If you have injuries to your extremities, or maybe you have fallen, but
Yes.
you have a specialty, which I don't know if too many people know about, and it's physical
Yeah.
therapy, helping people with pelvic health.
Correct. Yeah, it's definitely something that I think is with time building more awareness in the community that it even exists. But, It's definitely come a long way, even in honestly the 5 years that I've been in practice, since graduating PT school. It is pelvic health, which is sometimes a topic that I think can be taboo for a lot of people to talk about. No one wants to talk about their bladder leaks. No one wants to talk about their constipation or their pelvic pain. So having this space is also, I think, a very empowering thing for both men and women. I treat both genders, and I honestly treat all ages. So I think probably my youngest patient has probably been about 15, 16. I think my oldest patient has honestly been 97 coming into the clinic, which great for them. So I've definitely treated all ages in the spectrum. And like I said, I'm treating both genders as well. But it's definitely something that more people need to be talking about. So like I mentioned, anything in pelvic health realm can be from any issues with your bladder, whether it is leakage or maybe incomplete bladder emptying. It can be constipation, maybe difficulties and pain with your bowel movements. I also treat a lot of other secondary medical conditions like interstitial cystitis, endometriosis, IBS. So there's a whole umbrella of things that pelvic health covers that sometimes people live their life and don't realize that, wait, I could actually get help for that. Usually a lot of times I see people when I've had this problem for the last 15 years and you're just telling me there's something I can do about this. I just thought I have to deal with it. And I think a lot of times we tell ourselves that, we're living our life. It's fine. I'm breathing. It's good. But you don't realize maybe how much these things are actually impacting your day to day until it gets to that point.
I agree. I mean, I'm sure those type of people are silently suffering and maybe
Totally.
not able to go out and socialize as much as they would like to, which would lead to, shame and all these different things that can really.
Isolation.
Yes, yes.
Mhm.
So again, I'm so excited to have you on, to just talk about what it is. It's like you said, it's embarrassing, right? We've been
Yeah.
told there are private parts, so we got to keep it
Yep.
private. And to be able to talk about it to even our providers, it's just like, oh, it's embarrassing. But
Exactly.
I'm hoping after this program, people are, able to, or you're at least giving them permission to open up that conversation.
Exactly. I think having the confidence to have those conversations is really important. And anyone that is, especially their first appointment with me, it is just a lot of talking because people do get very nervous about coming in. They're like, I don't know what this specialty is. I don't know what we're going to do. And I just really reassure people that the first part is just all about talking. If you aren't completely transparent and honest with me, it's hard for me to be the mind reader also, so that we can figure out, okay, well, what are your individual goals that you want to work on? And how can I personally help you get there? But if once again, we're not open and transparent about these things that honestly a lot more people go through than you ever think they do, then it is really difficult. I have a ton of people that, once they go through the process, they'll even joke like, I was at work and I was talking to 3 other people and they all had issues, but they didn't know pelvic PT. Even I've had patients before, they tell someone that they've gone to PT and they go, Ashley was also my therapist too. And you kind of just out through the grapevine.
Awesome. They're coming out of the closet. There you go. And Ashley Kaufman. Yes, yes. We have her on. Yes. So Ashley, I know that we'll have time to talk after your slide presentations.
Yep.
I'm eager to have you show some information for people out there. So that way they know, what's the pelvis? What is that?
Exactly.
So, I know you have a great presentation. So I'm going to have you put that up and can't wait
Perfect.
from you.
Because it is so true that once again, we don't even know maybe these muscles even exist. I know before I even personally got into pelvic floor PT, when I went to PT school, I did not know that this is what I was going to be talking about all day. I joke, all I talk about is pee, poop, and sex probably during 30 to 40 hours of my week. But it's once again something that is very important for a lot of people. So the focus that I wanted to cover during this is really the impact that incontinence and urinary urgency can have on fall risk, because I know that fall risk is a topic that you cover a lot with during these presentations as well. So we're going to kind of chat through that and, see where it takes us. So just kind of a little bit about me. I know we already kind of covered this, but, my name is Ashley Mahan. Right now, I am the Director of Pelvic Health at Peak Physical Therapy. I'm located in the Braintree office, but we also have great therapists in Scituate, Duxbury, Norwell, even coming soon in Quincy. So we're kind of scattered. Pelvic health physical therapy can be difficult to find for a lot of people. You can find an orthopedic clinic probably on every corner that you kind of drive through in town, but not every physical therapist is necessarily trained in pelvic health. And I think that's a really important thing for people to know. There is a total separate training coursework that you have to go through. So I got 4 years of my bachelor's degree. It took about 3 years to get my doctorate in physical therapy. And then afterwards, I took separate training courses through an institution called Herman and Wallace in order to be able to treat pelvic health conditions. So once again, I think that's always something important to note, because you want to make sure if you're treating pelvic floor that you are going to someone who has done that extra coursework so that you get the best treatment possible. And then I've been a pelvic floor specialist pretty much ever since I graduated PT school. So I'm going on about 4.5, 5 years now. So in terms of how prevalent some of these issues can be, so urinary incontinence with a study that has done usually actually occurs in 60% of females and about 14% of males. And this statistic unfortunately does increase with age, especially with different hormone fluctuations, especially more in the female population. Even in terms of men, like I said, I treat both genders. I do see a lot of occurrence of urinary incontinence after prostate cancer treatment. So when people have a prostatectomy and have their prostate removed, urine leakage is a common post-op complication as well. So I'd say that's a large portion of what I see during my day. Now, if we link incontinence, leakage with falls, these are commonly occurring, and it's also associated with increased morbidity. So, if someone has a fall and they break a hip, that same thing. It's always increased with that increase in morbidity as well. So once again, more people probably go through it than we ever think they do. I think people silently suffer a lot of times and think I can be the only one that's experiencing this. Now, when we look at the different types of incontinence that it can exist, these are probably the 3 main types that I usually see throughout the clinic. So it really just has to do with what triggers your leakage. There is a category called stress incontinence, which is the loss of urine with any physical exertion or increase in abdominal pressure. So some examples that can happen are leakage with a cough, laugh, or sneeze, bending, lifting, running, jumping, pretty much like any physical movement that when you go to perform that action, urine leakage can happen. And it can range from just a dribble to maybe even losing your whole bladder. Now, the second part is urge incontinence, and this is what we're really going to focus on during the presentation. It is a loss of urine with that strong desire to have to go to the bathroom. It can happen within a few seconds, or it can happen within a couple minutes. And what happens with that is your bladder is contracting too soon. We're going to do a whole kind of diagram about how bladder and pelvic floor are related, but pretty much anyone that falls under this urge incontinence is anyone that might come into the clinic and say to me, oh yeah, when I feel like I have to pee, I am running, I'm pushing my family members out of the way and saying, you can't go into the bathroom. They're probably rushing to get there, and that's why it can be highly linked to maybe a potential fall risk. Now, you can also experience the two together, and that's called mixed incontinence. So definitely sometimes these things can happen very separately for people, but a lot of times I do find that probably someone is going through both of these things at the same time. Doesn't necessarily change how we look at it PT-wise, but in order to track progress, we like to know what exactly is maybe triggering some of the incontinence so that we can really figure out, okay, what can we do functionally in the clinic to make sure that's not happening in the outside world? All right. So now different risk factors that put people at risk for developing incontinence. There is a whole lot of things that we can go through in our lifetime that put us at that higher risk. One of the ones that I have on the left-hand side, pregnancy. So just having to carry that baby for 9 months, it's a lot of work for your pelvic floor. And then we also look at delivery. Say if someone had a very long experience with pushing, if they had any tearing or stitching that occurred, and maybe that caused some extra damage to the pelvic floor. Pelvic surgeries. So we see some people after prolapse repair or hysterectomy, that can sometimes develop scar tissue depending on the area, and that can impact the bladder as well. Obesity, a higher BMI has also been shown to put more pressure and weight and strain on the pelvic floor. Older age, I think I mentioned even when we were doing our intro that hormonal changes can also exist that impact the overall strength of the pelvic floor. And then thinking about hormonal changes, menopause is a big one. So I definitely have a lot of patients that are, in their menopausal stage and afterwards, and leakage is definitely something that we like to tackle as they're here. All right. So then we want to think about how urge incontinence and falls are linked together. So actually fall risk can double with older women that experience urge urinary incontinence. Once again, it's that strong urge to go to the bathroom. We're trying to run and get there, and we might not be making it in time, and our bladder leaks from there. All right. So next, there's also a separate subcategory that goes along with urge urinary incontinence. And a lot of people have probably heard the term of overactive bladder. It's not a happy bladder. So when we have an overactive bladder, people will experience that sudden uncontrolled urge to urinate, but this can also exist with or without incontinence. And I think that's something important to remember. Now, what can happen is there can be sometimes a mismatch between the signals between our bladder and our brain. Our bladder and our brain are always working together. We can see in the picture on the right-hand side, we have that nice normal bladder. Your bladder is always filling and stretching throughout the day, and it's pretty much made up of a big muscle that is surrounding the bladder, and that is what is sending that signal up to our brain. It has to get enough of that stretch through the bladder in order for our brain to say, hey, it's time for me to go to the bathroom. But sometimes that mismatch can maybe trigger the bladder to contract too soon. So you can see on that picture on the right side, there's all these arrows kind of coming into the bladder, and that's probably to represent that bladder actually contracting. Now, secondly, the bladder muscles can also just be too active. So that has to do with that contraction piece. The bladders are contracting way too much compared to what it should normally do. Really, in a perfect world, when that bladder is filling and stretching, when we get our first urge to go to the bathroom, it should be kind of like a warning signal to us. It shouldn't have to be like an immediate need for us to take to actually go to the bathroom. We should be able to finish what we're doing. Say, for example, if someone is washing some dishes at the sink, they shouldn't have to drop everything and go. They should be able to finish what you're doing at the sink, finish your dishes, and then calmly go to the bathroom after that. And once again, that's kind of like a stop guard for our bladder to say, I'm not at my full max capacity. I'm just giving you a heads up right now that you are going to have to take care of me pretty soon. All right. So this is where the meat and potatoes is really going to be, is really understanding what our pelvic floor is, because this is going to help with our understanding on how pelvic floor PT even can help with incontinence. A lot of times people will go to their doctors potentially for some of these bladder issues, and they're like, oh, there must be a medication that I can take to help with this. But PT and conservative therapy actually does have really positive outcomes for a lot of people. So I think it always is one of the first line of defenses when it comes to actually treating any type of incontinence, separate from, once again, maybe just treating this solely with medication. So when we're talking about the pelvic floor, your pelvic floor pretty much is a set of muscles that live within the base of the pelvis. We like to call it like a bowl of muscles that sit inside the pelvis. Now, you can see on the right-hand side, we have a diagram, and this is just to show that men and women also have pelvic floors. I have a lot of guys that come in and like, I didn't even realize I had a pelvic floor. Really, the mechanisms work the same in terms of bladder and bowel control. Just one of the big differences is going to be that, men don't have the vaginal opening like a female would. So when we're taking a look at this picture, that bright red kind of sling of muscles right underneath the organs, that is making up your pelvic floor. So if we're looking at this model, it is surrounding the urethral opening right in the front. It is surrounding the rectal opening right underneath where the bowels are labeled. And then it comes back to like your tailbone and your coccyx. And then when we're looking at the female model, it also surrounds the vaginal opening. These muscles also can be very highly linked to low back, hip pain, and abdominal pain and dysfunction. Because if we're thinking about this big bowl of muscle, once again, those muscles are connecting back towards your tailbone into the spine. It is also coming out to the sides laterally into the hips. So actually there is some pelvic floor muscles that are considered hip muscles. And then it's also connecting to that front of the pubic bone. You can see that it's kind of like a small white circle in the front. And same thing, pelvic floor can actually reproduce some pain and discomfort into the abdominal area. So, I think it's very important to note that once again, pelvic floor has a lot of control, bladder and bowel wise, that sometimes we don't even think about if we're not having any issues with it. We pee and we poop, but that's about it. We don't think about actually how we do those mechanisms. All right. Perfect. So when we're thinking about different functions, so I had mentioned, bladder and bowel control, and that's where the sphincteric function comes in. Your pelvic floor should have this constant natural resting tone throughout the day. And it's going to keep the urethra shut, keep the rectal opening shut, so that in a perfect world, as you're doing your things, nothing is leaking out when it shouldn't. But they also need to relax and let go appropriately in order to actually let the urine out and to let the stool out. Another piece that the pelvic floor plays a role in is support. It supports all of those pelvic organs that are sitting right on top of it. It supports the bladder, the prostate, the rectum, the uterus in a female. So it keeps everything kind of lifted and supported. It also plays a role in sexual function. So common things that I can see in the clinic are maybe types of pelvic pain, whether it's, it can range from vaginal pain, maybe with intercourse. I actually do treat penile pain. When we think of sexual function, it plays a role in orgasm and arousal for both men and women. So definitely big role there. And then also stability. I mentioned that it's highly linked to the back and the hip. So we want to make sure that pelvic floor is a strong piece to this to provide that overall stability there. So once again, it does way more than we think it does. All right. So we want to now focus on how this bladder and the pelvic floor are connected throughout the day. So like I mentioned previously, your bladder is always filling and stretching in size throughout the day so that we feel that real stretch in the bladder to send that signal to our brain saying we have to go to the bathroom. So on the first part, we have bladder filling. What happens is our bladder relaxes and stretches so that more fluid can be accommodated in the bladder. But what happens is our sphincter muscles, and those are pretty much the outer pelvic floor muscles that are wrapped around the urethra, those stay contracted because nothing wants to leak out at that moment when the bladder is trying to fill. Now, when we say go to the toilet and go to the bathroom, reflexively, our pelvic floor should know what to do. You probably don't have to sit on the toilet more often and be like, okay, pelvic floor, do your thing. Peeing just happens, and that's how it's supposed to work. It's supposed to work without you thinking about how it works. So what happens there is the bladder then contracts, those muscles in the bladder, they're pretty much kind of like squeezing and pushing the urine out essentially, but the sphincter muscles in the pelvic floor then go to empty and relax during that moment. So actually, this next slide actually shows that same mechanism that I just mentioned. Once again, in, say, that top picture, the detrusor, which is that bladder muscle, is relaxing. Pelvic floor contracts. You can see that the bladder gets about halfway full. That's our sensation saying, hey, I'm getting a little full. You might have to take care of me. But urination is inhibited until it's actually appropriate. So when we get to the toilet, then that's when the pelvic floor knows I need to relax. And then as we go to number 4, micturition, which is pretty much just urinating, that's when that bladder muscle will contract, pelvic floor relaxes, and you can see those cute drops of urine just coming out because pelvic floor is letting go and opening until that bladder decreases in size and empties pretty much a good portion of the bladder. There's always a little bit of residual that's left there, so it's not that you empty the tank to absolutely zero, but we try to get as close as we can to that. All right. So now, before I move on, any questions so far? Because I know that's a lot of information all at once.
Gosh, I am just absorbing everything. And as you're talking, I can't help but think about how, the heart. I know you're talking about the bladder.
Yeah.
But heart, it relies on the filling of the blood. And then there's a point where there's a stretch. And then when the stretch happens, that's when it knows to push the blood out. And instead of sphincters, we have these valves that helps to keep the blood in the vessels, in the ventricles, so that it's just filling correctly. So it's amazing how our body has, even though it's different organs and they do different things, their function is the same. It's
totally.
Isn't it amazing? So as far as the bladder, what you've covered so far has been amazing. What comes to mind is, what can make a bladder be overactive? Is that different from bladder spasms? Because, before we came on, I was telling you that I used to take care of urology patient when I was a med-surg nurse. And sometimes what would happen is after a patient would have maybe a cystoscopy or, male patients in particular, some women when they have, so for men, when they would have prostate or bladder surgery, they come back to the floors, their bed, and they have a catheter. And fresh post-operative patients, they would have what's called a bladder spasm. And they would be given medications, but how is that type of spasm different from overactive bladder, or is that almost the same?
Honestly, I kind of put it in a very similar category. I think that even if it's a bladder spasm, it really is that overactivity in the bladder muscle. And I think there can be a very wide spectrum on when people might experience this overactivity. There are some people that, once again, may be experiencing all day long, or there are certain things that maybe irritate them throughout the day. And that's even one of the self-management pieces that we're going to cover moving forward. So sometimes people may just notice that overactivity in the bladder, maybe with just actually daily habits they're doing. There are certain things called bladder irritants that we're going to cover, and that can create a lot of overactivity. But there can be a portion of patients that maybe experience this overactivity all day long, and that's where sometimes medication can come in, or there's even a procedure that is called bladder installations, where they're pretty much trying to flush the bladder essentially with this specific type of solution to decrease that overall irritation within the bladder lining itself. So I like to, once again, put them kind of in a similar category with that bladder spasm, as maybe people would experience overactivity during the day.
Great, thank you.
Yeah, no problem. All right, so we're going to go into next, like how the bladder should typically function during the day. So I would say these are probably the goals that I would have for most people as they're coming in for PT, like what we want to try to accomplish in this process. So one of the first things that people should be doing in a perfect world is we should be peeing every 2 to 4 hours per day. So I'm usually saying, okay, it doesn't matter if you're within the 2 or within the 4, as long as you're in that benchmark, I'm good with that. And that pretty much equals out to 6 to 8 times per day. So typically, if someone maybe is experiencing urinary urgency or incontinence, they typically are going more frequently than probably every 2 hours. I've had some people that go to the bathroom 20 times a day, and they must be spending their whole day in the bathroom, or they are so nervous about the leaking happening that they start to go more often, even without the urge. And that actually ties into that next piece. No, just in case going to the bathroom. People are guilty of it. They go hop in the car, they have to go grocery shop, and they're like, I'll just go because I think I'm going to be out and about. We want to try to avoid that as much as possible because it's teaching that bladder that it's okay to empty too soon. We don't really have that urge to go. We're just telling our bladder, let's just empty now. And that can sometimes lead to an increase in urinary frequency and urgency over time. Now, nighttime is also a big piece that we look at. 0 to 1 is kind of the magic number in terms of how many times people should be getting up at night. If you are over the age of 65, 1 time at night is a normal number. However, I do have patients that come into the clinic that are up 4, 5 times in the night, and they are not getting good sleep quality either when that is the case. And then also when we're going to the bathroom, we want to make sure that we're not hovering over the toilet. A lot of people can be guilty in a public restroom that they don't sit down on the toilet because they're worried about germs. You got to sit your butt down, and we don't want to push the pee out. Once again, that pelvic floor should know exactly what it needs to do when we sit down on that toilet. So we shouldn't have to feel like we are overexerting ourselves and adding extra force to try to empty all the way there. If we say are doing that habitually, sometimes that can actually lead to some of these future pelvic floor problems because we're not letting our pelvic floor work the way it should naturally perform. So once again, these are definitely goal points that I'd have for a lot of people in terms of what numbers maybe we're aiming for to have these normal bladder habits happen throughout the day. So now that we talked a little bit about how bladder, pelvic floor is working together, what can we personally do in our day-to-day to help with reducing urgency incontinence that also is linked to that fall risk that we mentioned at the beginning? So we're going to go over 4 different categories. We're going to talk about what fluids we're drinking throughout the day. We're going to talk about bladder retraining, pretty much like getting your brain and your bladder on the same page in terms of daily habits. We are going to take a look at how we can reduce our home hazard risk. So things in our environment that maybe make us more prone to, especially the falls if we're trying to rush to get to the bathroom. And then we're also going to talk about strength and balance training and how that's even related to PT and maybe even just your general exercise program. So now, first one, fluid intake. Water is very important. It's important for general health, but it's very important to our bladder as well. Usually the general recommendation on water intake throughout the day is about half our body weight in ounces of fluid per day. And about 2/3 of this should be water. Now, people usually get really freaked out when I tell them this number because they're probably nowhere close to actually getting as much fluid as they should during the day. One thing I like to do, and I find this to be an easier strategy, is just thinking about sipping throughout the day. So we're not trying to chug our 30, 40 ounces of water all at one time, but if we can think about sipping maybe, 4 ounces every hour, that usually kind of breaks it up to a more doable goal for a lot of people so that they're not so overwhelmed by the amount of fluid they have to take in. Now, if someone is leaking, a common thing I hear is, well, if I'm leaking, why would I want to put more fluid in my bladder? Because am I just putting more fluid in so I just leak more? It actually works the opposite of what people think it is. If you do not have enough of that water, it makes the contents of the bladder pretty irritated and pretty acidic. So actually, plain water throughout the day can actually help with diluting the contents of the bladder, making that lining of the bladder less irritated. So hopefully those contractions that we were mentioning are not happening too strong or too soon. So actually, drinking water is one of the best things people can actually do to help with their urge and incontinence. So again, it's crazy how it works. Now, there's also things that we might be drinking throughout the day that can irritate our bladder. So this is that category of the behavioral things that sometimes people are doing that they might not even know is maybe making a difference. I joke, it's pretty much everything fun in our lives that usually people like to actually ingest during the day. It's carbonation. If people are drinking seltzer water, that does not count as your plain water during the day. The carbonation actually irritates your bladder. Alcohol, citrus. So maybe that slice of lemon in your water might actually not be the best thing for your bladder right now. Caffeine, reducing maybe the cups of coffee, or can we mix in a decaf cup of coffee within your routine so you still have the comfort of coffee? Artificial sweeteners, so maybe thinking of different juices and drinks, going back to the carbonation with soda. These are things that I think can affect people differently. So it's always, I think, worth the shot for anyone to adjust maybe the amount of bladder irritants they have. If, say, once again, they maybe cut back on some of their coffee, they don't notice a crazy difference, okay, then we got to investigate maybe some other things that could be bothersome throughout the day. But I always say this is, once again, like a first line of defense that people should test out and see, okay, if I'm better about my plain water and I decrease these bladder irritants, is that going to help the lining of my bladder be a little bit happier? All right, perfect. So now, the next category of things is called bladder retraining. So these are, once again, some easy things that people could do throughout the day to see, okay, is this going to help me get on track to some of my goals? There is a method that is called time voiding. And sometimes even when you go to a urology office, they might suggest a similar thing. It is voiding at very specific times, working on the goal of urinating every 2 hours. So say I have someone fill out a diary and they notice they pee every hour on the hour like clockwork. Maybe then my goal is, okay, you're going to try to make it an hour and 15 minutes. Let's see if you can do that. They do it for maybe a week or two, and then we're gradually continuing to build that time up until we get to the 2 hours. Our bladder is very retrainable. It's smarter than we think it is. So we can actually change that overall bladder capacity by actually working on suppressing that urge a little bit and working on that timed voiding. So once again, this is something easy enough that people can try throughout the day to see, okay, can I put myself on more of a schedule to make sure I'm emptying properly? And then we talked a little bit about that just in case urination. We do not want to catch people urinating if they do not have that urge to go. Once again, our bladder should tell us when our bladder is really about full. If we go too soon, our bladder starts to get confused on when that overall stretch is supposed to happen. So that stretch over time will happen a lot sooner than maybe if we were not going just in case all the time. It definitely is hard for a lot of people to put the strategy into play, but with a lot of practice with it, people do notice that slowly and gradually over time, it gets easier to focus in on. I think it also has an anxiety component to it. With a lot of these bladder issues, people really freak out about it. And once again, we get in our own head about all the bad things that might happen, or maybe based on past experiences that maybe they had with their bladder. And the more we worry about it, usually the worse, that urgency is going to feel. So sometimes we got to just calm ourselves down from it. Now, there are different things, that same thing, you can do to help with suppressing the urge. So these are actually a few easy strategies that we like to use to see, okay, can we calm down that sense of urgency when it happens and see if we can delay that going to the bathroom, even just by a couple minutes. So the first one that you see on the list is diaphragmatic breathing. And pretty much all that is just taking some nice deep breaths. I like to think about you're filling your belly and expanding that rib cage as you take a nice deep breath in. And then as you exhale, the belly just relaxes down. Doing maybe 5 to 10 deep breaths also helps calm down that sense of anxiety that I just mentioned. And nice deep breath in, let it go. Now, another thing, funny enough, is heel raises. And you can see a picture of that on the right-hand side. You see this woman just holding onto a chair for a little bit of balance, and she's just coming up onto the toes, raising those heels, and then coming down. There's actually a connection between nerve roots in our calf and actually relaxing our bladder muscles. So actually, funny enough, 5 to 10 heel raises can trigger relaxation in their bladder. The more relaxed your bladder is, the more it can fill and stretch, and hopefully you don't have that urge to go to the bathroom. Now, the next one is quick Kegels, and we're going to actually talk about how to properly perform a Kegel in a little bit, so we'll kind of cover that too. But same thing, if we actually squeeze and relax our pelvic floor about 5 to 10 times, it can trigger bladder relaxation. And then last one is distraction. You just don't have to think about, I have to pee. I don't care what you think about, whether it is imagine a dry desert, not a running waterfall, counting backwards from 10, just taking our mind off of, I have to go to the bathroom. Now, so far, any questions on any of those strategies, or seem like pretty easy, doable things?
It's amazing. It's really amazing that there are different type of strategies. I would say maybe the typical ones, and maybe people don't know that they're doing it when they have to hold their urine.
Yeah.
Because you think that, the bathroom's minutes away. Maybe the quick Kegels, maybe, I don't know. But definitely distraction, but distraction can be difficult if it's raining outside.
Yeah. Then you can't escape the water.
But I love the heel raises. That looks very different. I don't think people could even think of doing heel raises as they're waiting in line. Usually the ladies' bathroom, especially when you're out, there's always a line. So I guess now, after watching this program, a lot of women will be doing their heel raises, right?
And it looks like you're just doing a really nice calf exercise, so no one will ever know you're doing it for your bladder, which is the great part about it.
I love it. It's very discreet.
Exactly. And that's where I like to use a combination sometimes, but then people will find that they find the ones that work best for them. And I go, stick with it. It works, go for it. So now we want to also think about how can we reduce the urge at night? Because this is definitely a very common thing. Even as statistics shows that 85% of women over 65 years old of age experience nocturia, which is waking up more than one time at night to void at night. And then over 2 episodes of nocturia, that getting up at night is associated with recurrent falls. So we want to try to also suppress the urge at night as well. So then once again, we're teaching our bladder, hey, we don't actually want to go to the bathroom. Really one of the things that we can actually do probably at night is do those deep breaths. Try to distract yourself. Count backwards from 10. Try to get yourself back to sleep. We don't want to respond to that first urge. We just want to, once again, go back to bed. Sometimes people will maybe reduce their liquid intake 1 to 2 hours before bed. Maybe don't have that piping cup of hot tea right before you're about to hit the hay, because we're just filling our bladder maybe once again with more fluid than it wants. And another connection that people usually actually don't put 2 and 2 together with this is sleep apnea. So actually with breathing difficulties, actually that has been shown to associate with the waking up at night to go to the bathroom. When you have sleep apnea, you have interrupted sleep. People stop breathing when they're doing that. Now, when we are sleeping, there are actually different hormone productions that are happening. So connected with that is a hormone called atrial natriuretic peptide. And what this hormone does is it causes the body to produce more urine with sleeping. Now, if we are not in a nice restful sleep, and usually people who have sleep apnea are probably not having that nice restful sleep because they're always constantly getting interrupted by their breathing, we are actually now producing more urine at night. And that's why at night, really, we should not be going to the bathroom as frequently as we are during the day. So actually talking to, if I have someone in the clinic, I'll even ask them, hey, have you talked to your doctor about sleep apnea? Is this something that you've noticed, or maybe your spouse keeps bothering you because you keep snoring at night? So I always like to double check on that, because actually I've had some people who have maybe gotten a CPAP machine, and that actually has helped with their nighttime going to the bathroom significantly. So again, funny connection that we don't really think of.
That's amazing. That's so amazing. I never thought how obstructive sleep apnea can interrupt or can cause nocturia, but I kind of makes sense in a way, because they're up already and maybe a little restless, and then they start thinking, oh, I feel like I have to urinate. But wow, thank you.
Exactly. Big connection there. So it's always worth talking to your doctor and your healthcare provider about that. So now, even some easy things also to take a look in the house. And I can imagine that this is even things that people just look at for general mobility anyways around the house. But especially if we want to think about that nighttime going to the bathroom, we got to make sure there is nothing in our way that is also going to contribute to fall risk. So making sure that we call them scatter rugs, pretty much loose rugs throughout the house, maybe that are not to the ground as they should or as flat as they should be, electrical cords, unsteady furniture. A lot of people furniture walk where they hold on for balance to try to get somewhere. Poor lighting. So maybe if someone is frequently getting up, maybe having a night light handy so that you can see where you're going. Even I know in my bathroom, in the sockets, there's actually little night lights that are built in, and it's really great for if you have to wake up in the middle of the night. And then also a lack of stair banisters and bathroom grab bars. Someone might have a grab bar next to the toilet to make sure that they can, especially if they have a lower toilet seat, get up and down comfortably, and that can definitely help. So making sure that we don't have anything in our way to prevent us from getting to the bathroom, and it'll also increase that fall risk. And then strength and resistance training. So we want to be strength training anyways for our general mobility, doing our functional things throughout the day, but actually doing strength and resistance training does have a connection with strengthening our pelvic floor. Some easy ones that people sometimes do in their day-to-day. I have a picture of a sit to stand. We're always getting up and down from a chair. You can actually make that an exercise. Maybe you try 10 times up and down without using your hands to kind of get up from that chair. Focus on maybe some nice breathing. Exhale as you go to stand up and come back down. That is going to help work on glute strength, hamstring strength on the back because we're coming up to stand. Another example that I have pictured is tandem balance. You put one foot in front of the other. You maybe have a chair or a counter handy, so you can always use that for arm support. Best you can. Maybe we try to decrease that arm support to add that extra challenge. But balance is also something that is shown to actually help increase pelvic floor strength. I also have some other examples like squats. We can, same thing, maybe use a counter or a chair, a sturdy chair, please, to make sure that we're adding a little bit of arm support. We come up, we come down into a nice full stand. Or even step ups. We can maybe use a staircase that we have in the house. Maybe use the railing, same thing for a little bit of arm support, come up and down with that same leg maybe 10 times. So any type of functional training, and we try to do this as much in PT as possible, so it ties into maybe some activities you're having trouble with also mobility-wise at home, but that is actually shown to help strengthen the pelvic floor. Now, we also like to focus on core strength, and really that's actually a part of your pelvic floor. We just don't ever think about it. Everyone always thinks about their stomach muscles. Your core is 4 pieces. You can see on that picture on the right, we have pelvic floor, that is that pink sling at the bottom right next to the tailbone and pelvis. We have our back muscles, which is the multifidi in the back right next to the spine. You have your diaphragm up top, and that's how we are breathing and managing pressure on top of our pelvic floor throughout the day. And then we have this deep core layer, which is that big, broad muscle in pink called your transverse abdominis. Now, a lot of times we like to work on the strength and coordination of the breath in the transverse abdominis. This helps with creating stability and also improve coordination to help reduce incontinence as well. So core strength can help. And then everyone always talks about Kegels. Everyone wants to Kegel. Now, the disclaimer with Kegels, it's not necessarily for everyone. This is where sometimes pelvic PT can come in handy because we can actually assess your pelvic floor to see, are Kegels the right exercise for you? For example, if someone is coming in, potentially with this urinary urgency, sometimes there actually can be extra tension in the pelvic floor. So it means that those muscles are too tight. They can put extra pressure on that bladder, so it's not filling and stretching like it should. Now, in that case, if someone has a lot of tension in their pelvic floor, Kegels actually are probably not their go-to exercise, because when we do a Kegel, we are squeezing the muscle. If a muscle is already too tight, do we want to keep squeezing it to make it tighter? Probably not. So, incorporated could be actually a little bit of relaxation training. But once again, this is where sometimes an assessment from a PT can help, because people can come in with the same diagnosis, but their body could be doing a totally different thing. We don't like to generalize, and that's why when we do our evaluation, everything is always customized to the person. Now, say if someone is trying to do a Kegel, you're pretty much trying to stop your urine stream. So sometimes people will test it out. They go to the bathroom, they try to stop their urine stream. But if say they can't do it, maybe they know that their strength in their pelvic floor isn't exactly where it should be. So if someone is doing a Kegel, as an exercise, I always like to say, you do not want to hold your breath as you're trying to squeeze as much as you can. You don't want your butt cheeks coming to the party. We want to just isolate that squeeze there. But same thing, this is where pelvic PT can really come in handy, because we're able to maybe assess and say, yep, you're doing it right, or nope, we got to work on that, because you can't see what you're doing. They're all internally, these muscles, and it's very hard for people to have that awareness of what the pelvic floor is doing. So kind of just, capping off on a lot of the things that we talked about. Just because something is common does not mean it's normal. Even though a lot of us will experience incontinence probably in our lifetime, it doesn't mean we can't seek help and talk about it. And it also means that these things are very treatable. But once again, kind of coming back to the Kegel example, it sometimes takes an individual plan of care to figure out what exactly is going on with your body and what can we actually do to address that. So I'm really hoping that, during this presentation, once again, it empowers people to take more control over their life, take more control over their health, and maybe seek help for something that they never thought was possible before.
Wow.
That's a lot of information.
I absolutely enjoyed it, only because it's just, again, talking about a topic that people don't usually talk about, and making it, your information was just so vast. You covered the different muscle groups, and it's the pelvic floor muscle is it. Okay, I talked about how the bladder reminded me of the heart. It kind of
Got a model too.
There you go. But it also reminds me of the diaphragm, how the diaphragm does its own thing, right, for the upper organs.
Correct.
So it's amazing. So as far as you mentioned how the pelvic floor can be tense or tight, and how
Yes.
Kegel is not for everybody, because, as a female, that's been the thing, after you have your babies, you got to do your Kegels, otherwise you'll get stress incontinence.
Kegel all your problems away and everything's fine.
I know. Kegel is the key, but you're telling us it's really not. And that's where your type of specialty comes in, so that you can assess. And you mentioned two people can come in with the same diagnosis, but it depends on how they present.
Bingo, exactly. And I think that can be the common misconception, is we link incontinence with, I got to strengthen everything in my pelvic floor. But actually, a lot of people don't necessarily know how to do the opposite. We call it a reverse Kegel. We are opening and letting go of that muscle so that there's less tension. So like I said, there's that big bowl of muscle that sits here. And sometimes, people might have a baseline tension in their pelvic floor that they actually need to relax a little bit more so that they can properly actually do a full contraction. I use the example of my arm all the time. If I'm doing bicep curls and I'm in the orthopedic side, I want to move through a full range of motion. Now, if my pelvic floor is too tight, it's like if my bicep was stuck here. Would you hand that person a nice 15-pound weight and go, just move like this? They'd be like, this exercise is not working for me. You have to be able to get a full range of motion in a muscle to make it a functional muscle. And that's sometimes the missing piece that people don't realize in the pelvic floor. If that muscle can't relax, it can't really truly contract all the way. So you got to work on flexibility before you work on strength truly.
Wow. And how the pelvic floor is connected, as you mentioned, to the low back, and also the pubic muscle, right?
Correct.
And so you could have all these different types of symptoms that you may not even think is related to your bladder problem, like maybe a low back. right?
And that's, even sometimes, so we actually have a shared clinic between orthopedics and pelvic health. So we actually find a lot of carryover where some of our orthopedic therapists might message us during the day and say, hey, I have someone that's going through low back treatment right now. They're not really progressing maybe the way that I expect them to. And then I did a little bit of digging because they typically don't ask the bladder bowel questions that we do during the day based on what they do. And then they discover like, hey, actually, with a further investigation, I found out that this person has a history of incontinence. Can you screen them out? And then usually that person maybe can get a little bit of treatment orthopedically and on the pelvic health side so that it actually addresses their low back pain the way it should. It's a missing piece that I think more people need to know about.
Definitely a holistic approach to
Correct.
localize. I love that. Now, as far as the ability to, you know, lose you talked about incontinence of urine. How about incontinence of stool?
Yeah, that's a good question.
Almost the same type of mechanism, basically the same type of exercises that you would give?
It can be very similar. So one of the mechanisms that sometimes can happen is people can also have rectal hypersensitivity. So it's pretty similar to that bladder over contracting. It maybe is that rectum is trying to fill and stretch, and it also has a stretch response saying, hey, I got to go to the bathroom. And maybe they actually don't require that much stretch in their rectum, and it's hypersensitive in that way. But people can also have a loss in that muscle control right around the rectal area. So same thing, we have sphincter muscles that are under our control to contract and relax. And sometimes actually people maybe lose some strength in these rectal muscles so that they are, once again, maybe opening too soon, especially with that rectal hypersensitivity that can lead to a loss of bowels. I even have some people that experience, both experience the bladder and the bowel loss occurring at the same time, or they can live separately of each other. So yeah, that definitely can be something that PT can also help with as well.
Yeah. And that's so fascinating to me. So again, the problems of pelvic health can affect so many different age groups, not just the older adults. But it's
Correct.
so fascinating. So it's never too late to really retrain your bladder, because you mentioned you have a 90-plus-year-old
Yeah,
that you are assisting right now. That's amazing.
exactly. It's really great because once again, it's one of the most conservative things that people can do. So I'm always like, let's give this a shot. If you are consistent with what you need to be doing, I'm always walking you through it. Say if we need extra help on the medical management side, whether it is working with urology or urogynecology, we're always in communication during the process. And sometimes it does for certain people, maybe take a little bit of mix of both. Maybe they do need a Botox injection to help with relaxing their bladder muscles, or they do need a certain medication, but along as an adjunct, maybe they do need the PT to help with the strength, the control of the muscle, and hopefully that can kind of come together in perfect harmony to help with their outcomes as well.
That's wonderful. That gives, I'm sure it gives a lot of people hope who are, again, suffering in silence, right?
Exactly.
Yeah, so I know I have a lot more questions, but I know we're close to the top of the hour. So can you give us one or two takeaways that you want people to kind of, think about, and maybe empower them with some sort of knowledge, so that way next time they feel like they can have this open conversation with their provider?
Yeah. Well, I think it all comes back to speaking up. Once again, it's that silently suffering that I feel like we sometimes can put ourselves in that box and feel like we are so alone in things. And I think we have to understand that our providers want to help us get there. They want to help, reach their personal goals. So if say that, like, that's the person that we can trust, even in pelvic PT, this is all I talk about during the day. So people always, even longtime patients, like, this is embarrassing. And I go, trust me, nothing is embarrassing in this room. So I think that once again, the speaking up and knowing that there's people there who care and want to help is one of the most important things that I hope that people can realize with time. We want to work together. We want to help you meet your goals, and that's top priority at the end of the day. And then I think even just being empowered to even talk to friends and family, because you never know how your experience going through something is also maybe going to help someone else that maybe you love in your life as well. So I think that can also be a really powerful tool to spread the knowledge within our community, and help each other out.
Well, thank you so much. I learned so much from you during our time together,
Awesome.
the viewers as well. So I really want to thank you. And I also want to thank the Quincy Health Department for continuing to sponsor the Aging Strong program. So if anybody has any question for you, Ashley, how can they get in touch with you?
Yeah, the best way to get in touch with me is via email. So my email is amahan, MAHAN, at peaktherapy.com. I'm always available via email. So any questions, you can always pass it along my way.
Great. Thank you so much. Again, thank you to the Quincy Health Department for sponsoring Aging Strong. Until next time, everybody, be well and stay safe. Thank you. Bye-bye.
Thank you.